in light of the election in Massachusetts, MoveOn reached out to members nationally and asked us to please have what they're calling emergency rallies for democratic backbone. There are hundreds of rallies today across the country, along with 6 or 7 right here in the boroughs in New York City. And here in Brooklyn, with the Brooklyn Council of MoveOn, we're gathering here on the steps of Borough Hall in downtown Brooklyn. The Dems in Washington, our Democrats elected in Washington, need to bring the change that they were elected to bring. And we need to do that starting with health care reform. All right, so the Democrats in Washington need to know that they need to bring the change that they were elected to bring, and they need to do that starting with health care reform. MoveOn is 5 million members collectively across the country, and we need to make that collective voice heard. We need to let the elected representatives that they have the support of the voters, that they have the support of Main Street. That's where 5 million MoveOn members, many of whom are gathered here today, we want to tell our elected representatives in Washington that they have our support to make bold action on health care reform. Before we move on to our speakers, I just wanted to say a few things in reaction to the political situation right now. Conservatives and capitalists have a few victories recently. The Supreme Court has decided to offer corporations the opportunity to buy advertising in political campaigns without limits on spending. That offers them yeah, boo! Thank you. That offers corporations a voice of we the people. Corporations are not people, we are the people. And then after the Massachusetts election, a lot of pundits are seeing that read as the public is moving away from the Democrats that they elected, that they're losing faith in the Democrats that they elected. And I want to point to a few statistics from a poll of those who voted in Massachusetts. One of the primary statistics of folks who voted to replace Senator Ted Kennedy, our Democratic champion of health care reform, with a Republican who does not support health care reform, 95% of those who voted in that election say that the economy is foremost of importance to them. 53% of the folks who voted that election who also voted for Obama in the 2008 election, who also voted for Brown in that Massachusetts election, say that tighter restrictions on Wall Street is what is going to make them more likely to continue to vote for Democrats. 56% of the Obama voters who didn't bother to vote in that election at all say that tighter restrictions on Wall Street will also make them more likely to vote for Democrats. 49% of the Brown voters support the Senate health care reform bill. So, those statistics point to the fact that even though a Republican was voted in to replace Senator Ted Kennedy, they do indeed want the Democrats to react and will continue to support Democrats in elections if, in fact, they get the reform that they voted those Democrats into office to bring us. So, are Democrats playing too much by the rules? Are they playing by politics rules? Are they, yes, are they not fighting hard enough for us? We need to stand up. We need those representatives to make action happen. So, if that's the case in Washington, maybe those Democrats are ignoring the obvious and ugly truth that public relations firms and media are weighing in heavy, not only on the issues, but on public opinion and ultimately with votes. We don't need public relations corporations and the media running our country. We want our elected officials getting their job done. Yeah. The public may be foolish and easily swayed, and dare I say, maybe even greedy and lazy, as are some in Congress. So lots of politics going on. Republicans are in lockstep and committed to block any kind of Democratic action, whether it's proposed by Obama or any other Democrat. That makes it difficult. There's a threat of filibuster to make. If you want to threaten filibuster, let's make them commit to the filibuster. Let's see them out there on the floor stating their stuff, and let the public judge what is the validity of their filibuster. And House Democrats don't trust Senate Democrats. I've read that a lot of places lately. Blue Dog Democrats are forming alliances against Democratic action. All this politic is going on. So now, back to health care reform. Some say pass the Senate bill as it is. Some say do reconciliation first, which is basically a finance action. Some say pass the bill and then do the reconciliation. I am going to dare to quote Paul Krugman here on such a thing, since he is a financial genius. Reconciliation is a real option, which may become necessary, and it could be used to improve the Senate bill after the fact. But reconciliation, which is basically limited to matters of taxing and spending, probably can't be used to enact many important aspects of reform. In fact, it's not even clear if it can be used to ban discrimination based on medical history. That from Paul Krugman on one of the possible actions in healthcare reform. So, on that note, I would like to bring on our speakers to speak to you about the urgent state of healthcare reform. First, let's hear from a public health care professional, as well as a public servant here in Brooklyn, Brooklyn's own Borough Vice President, Yvonne Graham.